Welcome to the Fitness Pain-Free Show, where I help physical therapists learn how to get their clients out of pain and back to training in the gym. My name is Dan Pope, and I'll be your instructor. I'm a physical therapist, coach, and fellow meathead. I love training just as much as you do and want to help you get all of your patients out of pain and back to the gym where they belong. Hey, what is going on, guys? Welcome to the Fitness Pain-Free Show. We have a great hot topic for you today. Are deep squats bad for your knees? Before we get going, thank you so much for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist, a coach, a personal trainer, and I am a meathead. I love all things fitness. This is the Fitness Pain-Free Show, where we help coaches and physical therapists like you get your patients out of pain and back to training. If you are on YouTube, please hit that like button, leave a comment, and subscribe to the channel. If you're listening to this via podcast, please leave a positive review. It helps me out greatly. And if you want to go that next extra step to support us, support the channel by subscribing to Fitness Pain-Free Insiders. Insiders is a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. It's my premium content updated by me. Okay, similar content to the topics of this Fitness Pain-Free Show, but more in depth. It's updated monthly. I've been updating it for the past 5 years, so there's a ton of stuff on there. I've got over 100 webinars, ebooks, and complete guides. You have access to a private Facebook group to have all of your questions answered by me. You can decide upcoming podcast topics and get started for just $1 for a week-long trial. After that, it's $9.99 per month. It's not very expensive, and again, it supports me out tremendously, and you can cancel anytime. If you want to check it out, head over to fitnesspainfree.com, click on the programs, and then click on Fitness Pain-Free Insiders online library to get started. So the other thing I wanted to look at a little bit, and I actually covered this very much in depth in my knee courses, but I wanted to figure out if squatting or strength training slows the rate of osteoarthritis because, if we strengthen the knee, maybe that helps it to stay healthier over the course of time, right? Do we have any research that shows that? Well, one study that I looked at was pretty interesting. It was the effects of strength training on the incidence and progression of knee osteoarthritis. They took 221 patients greater than 55 years old with osteoarthritis. About 50% of them actually had symptoms. The other ones just had radiographic findings, but their knees actually didn't hurt. And they gave them either a strengthening program or they randomized them to a range of motion group. So one group was kind of stretching, the other one was just doing a strength training program. And the strength training program, it wasn't super robust. They were doing a leg press, a hamstring curl, and a wall squat, right? It really wasn't a lot, but at least they were doing some sort of strength training, right? And squatting. The subjects exercised 3 times a week for 12 weeks, and that was followed by a transition to home-based exercise where they continued with the same exact program, right? They followed up these guys 30 months later, so a couple years later, and they looked at the rate of joint space narrowing, right? Basically, if you're narrowing in cartilage, right, so they'll do an x-ray and they'll see how much space is within the joint, and then they'll wait a period of time and they'll do another x-ray and they'll compare that amount of cartilage or amount of space between the bones to figure out if you're getting more arthritis or losing cartilage over the course of time. And unfortunately, they did not find a significant effect of strength training, right, and osteoarthritis. So if you strength train, it doesn't mean that you're going to delay osteoarthritis any faster than if you don't, right? So that's a little sad, but at least it kind of gives us a little bit of research to show that, squatting isn't going to make your knees stop wearing over the course of time. Unfortunately, that would be nice, but at least in this study, it didn't show that. I'm sure that if there were follow-up studies, maybe a more robust training group for longer periods of time, maybe we'll see something a little bit different, but at least in this study, it didn't show that. So squatting isn't necessarily slowing that rate of arthritis, right, or keeping the knees healthier over the course of time. It does, however, keep your knees stronger, right? And that's a good thing. You can say that's a positive thing for sure. So I'm not trying to discount squatting at all. And the other question I wanted to talk about was, are deep squats safer than, let's say, quarter squats, right? Because if you go deep into a squat, like we said, that's a little bit more stress on the knee joint. But the other piece is that if you go really deep into a squat, you probably can't use as much weight, right? Your 1 rep max for a quarter squat, if you train it, is probably going to be a whole lot bigger than your 1 rep max of a deep squat, right? And if you're used to squatting in any way, you'll realize that. And I also want to talk a little bit about this one study because I see it cited all the time. And I think it has some pretty big flaws. So I just wanted to speak about it briefly and see if we have an answer to this topic. And the study was by Hartman, 2013. It's entitled The Analysis of the Load on the Knee Joint and Vertebral Column with Changes in Squatting Depth and Weight Load. And I just want to quote some of the things from the study. So one of the first things they talk about in the study, which I largely agree with, is that there are no realistic estimations of knee joint forces for knee flexion angles beyond 50 degrees in a deep squat. So basically, as we descend deeper and deeper to squat, we're not really sure how much stress is going on the structures in the knee, and at least in the patellofemoral joint in this study. And the reason being is because there is a wrapping effect. So the quad tendon will go into the joint and dissipate some of those forces. There's also contact between the hamstring and the calf, which is going to alter the forces as well. And other studies didn't take this into account when they're trying to figure out how much stress is going on the knee joint in deep squats, right? And then the study goes on to have a whole lot of other statements which don't make a whole lot of sense given the first statement. And basically, the study says, concerns about degenerative changes of the tendon femoral complex and the apparent higher risk for chondromalacia, osteoarthritis, and osteochondritis in deep squats are unfounded. Now, this makes very little sense given all the research we just talked about a little bit previously, that deep squatting may potentially cause problems. Now, I'm not saying that deep squatting is bad for you, right? But I do think based on these studies, we have a reason to look into this a little further, right? Next statement that I didn't really love a ton was, with the same load configuration as in the deep squat, half and quarter squat training with comparatively super maximal loads will favor degenerative changes in the knee joints and spinal joints in the long term. And they were basically saying this just because in the bottom of a squat, we have the wrapping effect, we have the the calf bumping against the hamstring, which is going to protect the joint deeper into a squat. The author just stated that we don't have estimations of how much stress goes on the joint beyond degrees of 50, right? How can we make an assumption that deep squats are safe, but quarter and half squats are not, right? That's really unfair. And the last thing the author stated was, contrary to commonly voiced concern, deep squats do not contribute increased risk of injury to passive tissues. I really don't know that this study was helpful in determining whether or not squats are safe. And the reason why I say this is because I have seen so many physical therapists out there quote this article saying deep squats are safe. So look at this study. The study didn't find much besides pointing out the obvious that we don't really know, right? And I think that should be our biggest conclusion from all this, is that we're not really sure whether or not deep squats are safe, especially more safe than a quarter squat or half squat. We just don't have that research, right? So let's try to wrap this up a little bit. What are some conclusions we can actually gather from all of this, right? Because it seems like I just made everything more confusing. Well, in honesty, I think I did, and I did this kind of on purpose because this is such a gray question, right? And there's really not enough research to conclude whether or not deep squatting is actually safe. Okay, we just don't have that research. So if someone tells you yes or no squats are good or bad, that's probably not true. Okay, and I could be wrong, right? I'd love to hear some arguments. I'd love to hear thoughts in the comments, but I just don't know that we have research either way, right? So what are my thoughts? What are my kind of takeaways with this? Just keep in mind this is based on these research papers and also my experience as a physical therapist and a person that lifts weights. I've been squatting at least once a week, probably for the past 15 or so years, right? So obviously I love squats. My thoughts are that the poison is probably in the dosage. So if you're doing a lot of squatting within some sort of occupation that you have, some sort of manual labor on a very regular basis, that may increase the likelihood of osteoarthritis over the course of time and more pain, right? The other piece is that I think there's probably some sort of issue with elite level competition, right? And you'll see this in other studies as well, not just in squatting, but let's say running. Running is a good example of this. Osteoarthritis in the knee, there's no difference in folks that run versus not run. In fact, sedentary folks are more likely to have problems, more osteoarthritis over the course of time. This is probably because they are not sedentary. It's because they have higher body fat levels, most likely, right? That runners will not have more osteoarthritis over the course of time unless they're at a very elite level in terms of competition or doing a very high amount of mileage. And generally speaking, if you look at studies about osteoarthritis and activity levels, the body can handle a lot of activity before it starts to break down, right? at least within our joints, there's something called cartilage homeostasis. So when you do activity, right, you will potentially break down some of the cartilage within the knee, right? But that cartilage kind of builds back up and you have this homeostasis over the course of time. So if you break down more of that cartilage by doing more activity, your body responds by building that cartilage back up, right? And it maintains this homeostasis over the course of time. It's only when you get to a specific level, when you do enough, that this homeostasis is altered. Funny enough, being fat or just having extra body fat will also do the same thing. So it alters cartilage homeostasis. So generally speaking, I'm a little less concerned about people squatting and getting osteoarthritis. I'm much more concerned about them having too high levels of body fat and getting osteoarthritis. All right. So I think that generally speaking, for the large majority of folks, it's probably safe to squat on a regular basis if it's just moderately dosed over the course of time. Right? And I've heard several surgeons talk about this as well, but what we do know is that if you have an injury to cartilage at one point in your life, it sets you up for a cascade of issues over the course of time that can break down that cartilage more and more. So if we want to try to decrease the risk of osteoarthritis over the course of time, let's try not to hurt our knees in the first place, right? So you have to be careful to not hurt yourself. The other thing that I feel is that if you need to find yourself in the very bottom of a deep squat, and I'm talking to you, Olympic weightlifters, you have to train it, right? So training that deep squat is going to be super important for your performance. And the other piece is that if you don't train that deep squat and you find yourself having to sink into that deep squat position with a heavy clean or heavy snatch, and the knee hasn't been prepared for those forces, I think that's going to lead to issues as well. So if you're in some sort of occupation or some sort of sport where you need to have deep knee flexion, and I think deep squats are probably going to be beneficial for you, and you probably need to train it, right? And the other piece is that I don't know that you need deep squats in your life. It's not like if you don't use full range of motion of the knee in heavy squatting that you're going to lose cartilage over the course of time, right? If nothing else, we found that strengthening of the knee doesn't actually change the rate of osteoarthritis. I will say that it's probably good to squat deep over the course of time to maintain your strength and your function, right? Because you want to be strong, you want to be functional, but it doesn't mean that if you do that, you're not going to have arthritis as you age, right? I can't say that. Maybe more research will show us differently. Okay, what are some more conclusions here? Deep squats do increase stress on the knee joint generally, and I think you really need to keep that in mind. So if you have someone that has some sort of knee problem, right? So patellofemoral pain, or maybe they have some sort of posterior medial meniscus issue, osteoarthritis down there already, if you squat deep with them, it's going to increase stress on that joint. And this as long as loads are equated, right? Because like I said before, if you're doing a heavy squat, and you're going full range, you're probably not going to be able to use as much weight as if you're doing, let's say, a quarter squat, right? But let's not kid ourselves. If you go into a deep squat, it generally hurts more for most folks that have knee pain, all right? And I think there's something to be said about that. And we probably have to be a little bit careful with our dosage of exercise. Like I said, the dosage is probably what is going to relate to arthritis or problems in the knee over the course of time, right? So again, be careful with orthopedic issues. Like I said, patellofemoral pain, some sort of tibiofemoral joint problem, whether that's a meniscus issue, cartilage issue, whether that's going to be some sort of osteoarthritis. If you have that pain currently, injury currently, we have to be careful with our dosage of squatting. Maybe we're not going to squat as deep, at least for the time being, because that's too much stress to the joint. And as you get better over the course of time, maybe you add a little more depth, right? The other thing that I like to keep in mind is that if you've had a prior injury to the knee joint, just keep in mind that knee joint might not be able to handle as much force as it used to, because now there's an old injury and your body's going to always try to be on the lookout for keeping you safe and to make sure you're not doing too much in the future. And the last thing I will say is that the deep squat is a pretty challenging movement, right? A lot of folks don't have the mobility to even get down there, right? Or do it, in a way that's going to be conducive to things like Olympic weightlifting. So we have to ramp very slowly into a deep squat, especially if you're not used to it, because if you never squatted with heavy loads, at the very bottom of your knee flexion range, there's a chance you might hurt yourself just because you're not used to the movement, right? So it's a challenging movement, and just make sure you progress slowly into it. Lastly, I just want to say that I actually really like deep squats. I do them once or twice a week, almost always. And if I have any problems with deep squatting, it's not in my knees, it's more in my hip. So that's a story for another day. But I just want you to let you know my biases, right? And that I squat on a very regular basis and have all of my patients and clients squat for the most part, all right? So let's go ahead and take a look at some of these references. So I'm going to try to move my head out of the way so you can see the bottom half of these references here, right? So there's the bottom half. You just want to stop the YouTube video so you can see the video. I'll also include these references in the show notes. I know if you're listening to this via podcast, you're going to have no idea what I'm talking about right now, but I'm just showing the reference slide at the end. But what would be great, I'd really like to hear what you guys think after reading some of these studies, just because it really illuminates just how gray this area is, whether or not it is safe to squat deep or not, right? And I was also very surprised to see all the research that shows that squatting for a long period of time throughout the course of your life from an occupational perspective does increase your risk of osteoarthritis. And again, those few studies that were showing that elite Olympic weightlifters had more arthritis as well. What I will say is that some of these surgeons probably do have a decent reason to say, hey, squatting's bad for your knees, although that's definitely not the whole picture, right? So lastly, I just want to say thank you so much for all of your support. Hope you enjoyed this one. If you're watching this on YouTube, please give me a thumbs up. It helps tremendously. Leave a comment. I'd really like to get a conversation going about this. I'd love to hear what your thoughts are on deep squats. Do you think they're safe? Do you not? Who should use them? Who shouldn't use them? Please let me know. If you haven't already, please subscribe to the channel. If you're listening to this on a podcast, please leave me a positive rating and review, 5 stars, please. And if you want to support me that much extra, head over to fitnesspainfree.com, click on the Fitness Pain Free programs, click on Fitness Pain Free Insiders online library. You get a free $1 trial, and you get access to more great learning. And again, if you want to ask future questions and have me cover additional topics in the future on the Fitness Pain Free Show, you'll be able to if you sign up. Thanks again. I'll see you on the next one.